My passion for this line of work started very, very early, when I was just a little girl. My baby sister was born, and when she was 1 month old, she got very, very sick, and she was taken back to the hospital. It turned out to be an outbreak of a Coxsackie virus, and many babies died. And my baby sister, was almost one of them. And I couldn't see her, they were quarantined, but I would go there with my father and stand outside of the hospital, just waiting to see if somebody would just carry her by, if I could see her face. And that's when I got intrigued. That's when this whole thing started. What is a virus? How can such a tiny little thing make so much damage?
Our scientists at WRAIR are focused on the mission. They want to solve the health problems that are facing the warfighter. They know that we are putting people in zones of the world that have diseases that we don't always see in the United States, although sometimes we do, unfortunately, more and more. And so their goal, and they're really all about the science and the mission. They're all about protecting the warfighter and finding a way to safeguard their lives.
Our lab is focused on figuring out the immune response to viral pathogens of military importance.
Those viruses, for instance, are dengue virus, chikungunya virus, influenza virus.
We support a lot of units and also different departments as well, not only at WRAIR, also global overseas labs.
We have recently been asked, because of the quality of work that our team puts out, to produce data that will be used in filing for an FDA filing for a license upcoming, which is a pretty big deal.
This government customer is extremely collaborative. We work together to develop the appropriate solutions for the contract, which has made it just an incredibly functional and terrific relationship. I have a lot of professional respect for the people that we work with.
Because our team is at a good place right now, we're able to adjust on the fly.
And this is what's so unique, because we're all in the same place.
It's really dynamic. I would say, like, never ever have boring day ever. And I think everyone are great, really enthusiastic to try to get the answer, try to get the work done. And I think everyone really see how much we contribute to the department and to CNTS.
Typically for clinical trials, meaning human trials, the time it takes from conception, design, execution, testing, completion can take years.
We are trying to minimize that amount of time, and because we're all in the same place and we all work very closely together, that can be done, so we can work very fast on it.
There's so many ways that what we do in military medical research will spill into and protect the lives of civilians.
Virus is everywhere. The children get sick in Africa, in Asia, and we develop vaccine to not only in people over there, people here too, even our children here.
The support that we get every day from CNTS, that plays a big role for us to actually achieve our mission. Without that, we couldn't.
CNTS have helped us significantly by providing resources.
Without CNTS, I would not be able to do my job.
Our employees have options. Right here in the greater DC, Maryland area, we have a myriad of pharmaceutical companies that they could choose from. These are much more lucrative positions, quite frankly, because they are in high-paying, high markets, of the pharmaceutical world. But our people are choosing to support a greater mission. They want the greater sense of satisfaction that their work is working for the greater good, and that's why they do it.
Our team, even though they're a small unit, they are dedicated. They are willing to show up early when they need to, stay late when they need to. They don't show up for the money, they don't show up for the glory, they show up for the mission.
We work really hard, we work late, we work sometimes weekends, and in order to make sure that every single unit is okay and supported.
Many Americans don't see the medical research that the military is doing. They don't see how much the military cares for their servicemen and women. They see what the media is telling them. They see the images of war, but they don't see how much the military cares. And in a way, I and my team can pass that caring on to the servicemen and women.
I feel proud that I am actually doing something to prevent these kind of events.
Now everything is global. There's no boundary. So I think somebody had to do something. And I'm glad we are part of it.
CNTS has given me the opportunity to work for the U.S. military and give back to those who give to us every day.
It's a small little thing that I contribute with. But in the grand scheme of things, it's just one little puzzle piece that fits in and that will help us move on and grow and find out how to fight these little things and how to prevent more suffering.